Hello, and thank you for joining us for what is going to be a lively discussion about chronic cough. We all seem to know somebody who has this chronic cough persisting throughout their lives. They want to get rid of it. They haven't really decided what it is. The diagnosis might be off. They might be getting treated for something that's not correct. Let's tackle this. I am so lucky to be joined today by Leanne Goldberg. She is the Director of Speech Pathology at the Grabscheid Voice and Swallowing Center at Mount Sinai. Welcome, Leanne.
Thank you. Happy to be here.
And also with Leanne is her lovely, darling patient, Barbra Kent, who has been a patient of the Grabscheid Voice and Swallowing Center, who did suffer from chronic cough, and she is proud to tell us today all about her journey about getting on the other side of that and surviving for 2 years now. So thank you, ladies. And let's just start off by discussing, Leanne, what exactly is the Grabscheid Voice and Swallowing Center and the primary areas of the throat area that are treated there?
We are an outpatient voice and swallowing center, and we treat all types of voice disorders, performance voice, neurogenic voice, transgender voice, and others, as well as swallowing and upper airway disorders.
Okay, today's discussion is focusing on that chronic cough specific area of that. Can you just define for us what exactly determines chronic cough?
Chronic cough is a cough that lasts longer than 8 weeks. There is also chronic refractory cough. The refractory refers to a cough that is unresponsive to typical or guideline medical intervention. And we have idiopathic chronic cough, which idiopathic means no known cause. And we believe that idiopathic chronic cough is neurogenic in its nature. What I mean by that is the Grabscheid Voice and Swallowing Center looks at neurogenic laryngeal hypersensitivity as an umbrella diagnosis. We see chronic cough as one of the phenotypes underneath that umbrella. Other phenotypes that coexist with the chronic cough under that umbrella are throat clearing, shortness of breath or dyspnea, laryngospasm, muscle tension dysphonia, and paradoxical vocal fold motion, also known as vocal cord dysfunction, and globus sensation, which is the sensation that there's a lump in your throat at all times. We have found that treating this neurogenic laryngeal hypersensitivity with a behavioral intervention through therapy alone without medications provides a great deal of success for our patients.
Excellent. And what is the prevalence of just that one slice of chronic cough?
Well, reports vary, and research states that chronic cough, prevalence of chronic cough is anywhere from 3 to 14%.
Of the whole population?
Yes.
Wow, that's a lot of people.
Yes, it is.
Affecting millions of Americans
Yes.
every day, and many of them with the wrong diagnosis and not getting treated, correct?
That is correct.
Okay, so Barbara, let's talk about you.
Sure.
What were the symptoms that kind of led you to think, I might have a chronic cough? And then can you talk to us about your journey of how you were diagnosed and how you got to the Grabscheid Voice and Swallowing Center?
Sure. Okay, I was coughing for approximately 30 years.
Wow.
And I was a lawyer, so I spoke a lot. Every time I spoke, I coughed. Every time I went to a play, a concert, a movie, I coughed. Every time I lied down to go to bed at night, to sleep, I coughed. I went to many doctors. None of them were ever able to offer any remedy, except some would say if your reflux were better controlled. And I would respond that the reflux is totally under control, and there'd be a shrug. The stress incontinence had gotten so bad that I was actually considering surgery. Had seen a urologist here at Mount Sinai and was thinking about it, but I was scared a little bit. So I was seeing Dr. Bressler, who's the onco-generalist here at Dubin, because I had breast cancer. And I thought, well, before I have the surgery, I'm just going to ask her about it. I've asked so many doctors, I can ask one more. So she suggested 2 things. Oh, she also had me do a CAT scan and some pulmonary tests.
Okay.
So when they came back fine, she said, first of all, sleep on 3 pillows. That will take, or at least alleviate some of the nighttime cough, which it did. And then she said to come to this department, to Dr. Curry, and see if they could offer anything. So Dr. Curry, I met with him and Leanne Goldberg, and they examined my vocal cords, and he said they were fine. And then he said, well, I recommend two things. One, that you change your cough drop, and I have to say I thought that he was joking, but he wasn't. So I changed my cough drop to Luton's sugarless, like he said to do. And he said to me, Leanne Goldberg, which I did a number of times, and she taught me how to feel the catch coming and how to breathe and take water and swallow it. And I do that all the time, though, now, not just when I'm feeling it. And she said that was okay. And, you know, it's just really changed my life. I don't dread talking. I don't dread going to the play. And I don't annoy audiences any longer. I even give out cough drops.
That's an amazing story. And what a journey, too. And Leanne had relayed that you were diagnosed with GERD, and other physicians in the past thought that this was acid reflux or gastrointestinal reflux. So was there a connection to the GERD? Does GERD get often misdiagnosed? Does chronic cough often get overlooked when this happens? Can you talk to us about that, Leanne?
Sure. So the most common etiologies of chronic cough, one is GERD, or gastroesophageal reflux. The other two are postnasal drip and asthma. And we can treat chronic cough with coexisting diagnoses, including reflux. Many of our patients who we treat and that have success with the behavioral intervention have reflux, as long as they've seen a primary care physician or a gastroenterologist or pulmonologist prior to seeing us, and those associated conditions are being treated, we are able to help treat the chronic cough.
Okay. And let's talk about all of those causes and the process of diagnosing this, just because there are multiple causes. How does one go through this process?
Yes, so ideally, prior to patients coming to see us at the Grabscheid Voice and Swallowing Center, we want them to have had a comprehensive medical evaluation that includes pulmonary and gastroenterology workups, and that these associated diagnoses are found and are being treated. They come in to see us at the Grabscheid and have an interdisciplinary visit with both a laryngologist and a speech-language pathologist. We do a detailed case history and find out the frequency, the severity, how long somebody's been suffering with cough, what triggers they may have. We look at the patient's respiratory patterns. We do a voice assessment. We do a pretty comprehensive workup, and then we want to see the larynx and its surrounding structures. We use stroboscopy, either rigid or flexible, to view the larynx and its surrounding structures. We look at the larynx and surrounding structures at rest, while phonating or making sound, while breathing. And then in some cases, we want to evaluate swallow function, which we can do at the same exact time during that initial assessment to see if a patient is aspirating or has any swallowing problems.
So, Barbara, you mentioned you went through the pulmonary test. Did that kind of throw you off a little bit when somebody said, oh, by the way, go get a CT scan and some pulmonary tests? I mean, did that make you worry? It would make me worry.
Having just had breast cancer, the last thing I wanted was a CAT scan and pulmonary tests, but that was the cost. I don't mean financial cost, but that was the cost of getting a referral here, so I did them.
Okay.
I, was worried, but okay, I did them and they were fine.
It was part of your journey to finding a solution for this
That's right.
chronic
It was
cough.
part of the journey.
Yeah.
So it's a process of elimination.
It
just
is.
to make sure
It
that
is.
this is not stemming from the lungs.
Absolutely.
So let's talk about triggers. You had mentioned that it could be an array of things. Barbara, what were your triggers that you discovered on your journey?
She had asked me that. I don't know if you remember the answer, but I told her breathing. I mean, I coughed all the time.
Wow.
It was not like a perfume or a position or something. I coughed. I mean, I hope this is okay to say. told so many, I had to speak a lot as a lawyer.
Sure.
How many times I told people, I'm sorry, I have a cold, when I didn't. But to excuse the cough, I was many, many times, but there was no particular trigger. I just coughed.
So that's very difficult. So Leanne, what do you do in the situation? Well, first of all, let's talk about other triggers, and then what you did for poor Barbara's case, this was just going on all the time.
Yeah. So we break down the triggers into categories. There are inhalatory triggers or noxostimuli. That would include strong odors, cleaning agents, perfumes, scented candles. It can be cold air, dry air, humidity. That's just some of the inhalatory triggers. Others we define as mechanical triggers, and those are triggers that involve the actual use of the vocal cords and the larynx. That would be breathing, heavy breathing, gasping, speaking for a long period of time. Barbara's nodding to all of these. And then there are emotional triggers that we look at. So does increased anxiety or stress or even talking about the coughing to someone increase the coughing for the person? You know, this is a diagnosis that has a tremendous impact on patients' quality of life, and we're aware of that. One thing that's common that we're often shared with about is that, you know, people will move away from somebody on a train or on a bus thinking that they're
Contagious.
ill or contagious when it is just this neurogenic laryngeal hypersensitivity that is being triggered.
Okay, and then once the triggers are identified, or unfortunately in your case that it was just all the time, then what? What's the behavioral therapy and the interventions that you go through at the Grabscheid Voice and Swallowing Center? After
we decide that jointly in our interdisciplinary evaluation that it is in fact a diagnosis of neurogenic laryngeal hypersensitivity, the patient sets up an hour evaluation with a specially trained speech pathologist and 2 follow-up sessions. During that first visit, it's quite a comprehensive and detailed evaluation. We really get into when the cough started, what was going on in their life, details about the cough. Then we go into great detail asking the patients with those rather long and exhaustive lists of triggers, which ones are setting them off. After we've identified triggers, a big part of our therapy is education, explaining to these patients what they have been suffering with. What is neurogenic laryngeal hypersensitivity? How has that been manifested here and why? The etiology is still something that we are doing a lot of research on, but cough pathways have been identified. And even the chronic cough is very similar to what we found in chronic pain patients. So we educate the patient on basic physiology of swallowing, voicing, and breathing, and help them learn as to why they are having this hyperreaction or hypersensitivity to these stimuli or triggers. After they've been educated, and these are patients that have been suffering from cough for months, if not years, with no clear understanding of why. I really watch many times a light go on in these patients, and am actually told, thank you for letting me know what's going on. There is volitional control over cough. Many patients don't realize this. We help patients access that by paying attention, and you so eloquently described that you became aware of the tickle prior to the cough. And at that moment, we help patients with suppression techniques. And the benefits that we have found in our research here at Mount Sinai, working with patients on our specific protocol, has been 80% success. When we define success, we are saying or including reduction in cough severity or frequency, improved quality of life, which to us is enormous, and in many cases, complete amelioration of the cough, which is what we found 2 years later so far with Barbara.
Which is amazing. You are completely cough-free now, right?
I'm not going to say that I absolutely never cough, but I don't cough.
That's amazing. That really, really is.
And if I may say, cough is a protective airway mechanism, and it is something that we want patients to do in the appropriate setting.
Sure.
So if something, food or liquid is going down the wrong way, the appropriate mechanism is to cough.
good. Okay.
So, question about can you just give a few examples of what your suggestions are once they identify
Sure.
what that triggers, if they feel that tickle?
Sure. In the initial visit, we focus on one suppression technique that we find will work with the patient. Typically, it's an inhalation with a firm swallow of water at the sign of the urge to cough, or that tickle, or that tingle, or that itch that the patient's feeling. We have them practice it within the session, especially when the trigger is, or the urge to cough is present. Make sure that we see that they're doing it in the appropriate manner. And as Barbara said, some patients say, can I do this all the time? I love to give the analogy that a pilot learns to land the plane when it's good weather. So when he or she needs to land the plane in bad weather, they're able to do so. So we have the patient practice the technique when that urge is not present. So they're habituated to using that technique when the urge comes.
That's excellent. And what about, you always hear peppermints aren't that great to suck on because they could incite cough. Can you tell us some little anecdotal things that have worked for different patients that maybe our viewers can take away in the case they're experiencing a little excessive cough?
Sure. A lot of people use menthol lozenges. The active ingredient is menthol. Right away, we ask people to switch to non-menthol lozenges or candies that do not have mint or menthol. Sipping on water, sucking on ice are simple ways that a patient can work on suppression prior to coming to see us. Vocal hygiene is really important too. A lot of these patients are consuming dehydrating substances, which include caffeine, alcohol, and minimizing those. Again, we're big on quality of life, so minimizing those substances and increasing hydration with water helps as well. We also do focus on, after that initial session, we focus on respiratory retraining, helping patients with breathing patterns, relaxing this area of the throat, which tends to become very tender and tight, and also some other voice therapy techniques, because we find that muscle tension dysphonia is one of the underlying phenotypes under this neurogenic laryngeal hypersensitivity umbrella.
Earlier, you had mentioned that even cold weather, cold air can certainly incite a cough. Is that normal? And at what point does that actually become not so normal?
So I believe that that is a hyperreactive response. For somebody to be diagnosed with neurogenic laryngeal hypersensitivity, they usually have more than one of those phenotypes. So, like I said, a chronic cough that we would treat, this neurogenic laryngeal hypersensitivity, that chronic cough would be going on for more than 8 weeks and would be refractory or not fixed or helped with any other medical interventions.
Okay.
So a one-time cough with the cold weather wouldn't be something to react too strongly to. But if it's something that's persistent and over 8 weeks, come in and see us.
And is there at any point that they could be doing damage by coughing so much to their throat? Or you said it was actually a protective mechanism, so is it actually just helping prevent that damage?
So the chronic throat clearing or coughing can be damaging to the vocal folds. It's a strong, abusive or harsh behavior to the vocal folds when it's being accessed over and over again.
And then is there a surgical therapy for that? Should that come to that point, or do you feel like speech and swallow therapy can actually take care of all of that together?
So the research that's out there already, and the research that's ongoing here at the Grabscheid Voice and Swallowing Center, has shown that behavioral interventions alone is giving our patients success. Approximately 80% of our patients success. There are other treatments that include medication, sometimes a nerve block. The medications tend to have very strong side effects, and some of the research states that after a period of time being on these medications, they either have to titrate up or they don't work after a period of time. That's not the case with every patient. But we would rather somebody be able to improve their life with a behavioral intervention alone. And most patients are on board with that. Once they realize that there is some sort of volitional control, you know, the patients have really great success.
Sure,
it does need to
absolutely.
be, yeah, with a specially trained person as well. It is a specific treatment modality.
Definitely. And Barbara, did I hear correctly? You had the initial consultation, and then you only had, what, 2 more therapy sessions, and you're good to go?
It was either 2 or 3.
Yeah.
I may have come in for 1 more.
Wow.
But yes, I am good to go.
Decades of coughing, 3 decades of coughing gone in 3 visits with Leanne. That is very, very impressive, and I bet you're a very good student.
I will say that's the typical amount of sessions too. Not that you're anything but typical. But you know, 1 evaluation interdisciplinary and 3 to 5 sessions with a speech language pathologist. We started working on the voice, and then it wasn't something that really bothered Barbara, and she was having great success without continuing voice therapy.
That's phenomenal. And you had just touched on research. That was going to be my next question. Is there anything else you want to add about ongoing research at Grabscheid, on what you're studying, what your goals are? I mean, clearly you've made such amazing progress. Is every voice and swallowing center across the nation doing this, or is this something special happening in New York City?
Every voice and swallowing center is not performing the same consistent protocol or treatment. It is an exciting time for patients with chronic cough and neurogenic laryngeal hypersensitivity, because over the past 10 years there's been a burst of research trying to understand better this cough pathway, trying to understand the cause, the underlying etiology in these patients, looking at patient profiles and trying to identify better understanding of who will have success with this treatment and who may not. Who are those 20% of patients? Very exciting time here.
Great. And can you tell us how people can reach the Grabscheid Voice and Swallowing Center?
Sure. To make an appointment, a patient can call 212-241-9425.
And you're located right on 98th and Madison in New York City.
Yep.
Pretty
98th
accessible by subways.
Yes.
And you have lots of success stories, and just make the appointment. It certainly is worth it, and I think Barbara could certainly vouch for it.
Absolutely.
All right. Well, thank you, Barbara, and thank you, Leanne, for sharing your tips
My
with us
pleasure.
today, and we look forward to more. Thank you again.